What's up, everyone? It's Miles here from bootcamp.com, and today in pulmonology, we're going to be going over abnormal oxygen levels. So, the first category of pathologies that we're going to be going over today is something called hypoxia. And what's happening in hypoxia is that we're getting a decreased delivery of oxygen to the tissues. And so the first cause of hypoxia that we're going to be talking about today is hypoxemia. And usually in medicine, anything ending with the suffix emia refers to a blood condition. So in this case, we're talking about low partial pressures of oxygen in the arterial blood. And hypoxemia can be caused by things like high altitude, where there's going to be low partial pressures of oxygen in the inspired air that's reaching the alveoli. We can also get hypoxemia through hypoventilation. In hypoventilation, the pressure of inspired oxygen might be completely normal. It's just that we're not breathing enough of it into the alveoli. Hypoxemia can also be caused by shunts and diffusion defects. And remember that a shunt can be caused by something like an airway obstruction. And so in this case, we're going to have deoxygenated blood from the right-sided circulation shunt past the alveoli, and then it's going to mix with the blood in the left-sided circulation. So we're going to have deoxygenated blood mixing with oxygenated blood, and that's going to decrease the partial pressure of oxygen in the arterial system. And furthermore, we can have things like a diffusion defect like pulmonary fibrosis, where we have fibrotic tissue in the alveolar capillary membrane. When this occurs, gas is going to have trouble diffusing across the membrane, and so gas exchange is not going to occur properly. And so we're going to get deoxygenated blood flowing into the pulmonary capillaries here, and because of that diffusion defect, this blood is not going to be able to get fully oxygenated, and then that blood is going to travel into the pulmonary vein, and so we're going to have only partially oxygenated blood mixing with oxygenated blood in the left-sided circulation, and again, that's going to decrease the partial pressure of oxygen in the arterial system. And so high altitudes, hypoventilation, and shunts and diffusion defects all cause hypoxemia, and hypoxemia is a cause of hypoxia. The next cause of hypoxia that we're going to talk about is something called ischemia. And so ischemia is inadequate perfusion of the tissues, or inadequate blood supply to the tissues. And ischemia can be caused by many things, but usually it's caused by an arterial blockage such that we have obstructed blood flow to the tissue. And because in ischemia, blood is not reaching the tissues properly, not only is oxygen not reaching the tissues, but also different nutrients found in the blood, such as glucose, is also not reaching the tissues. And so the tissues in ischemia are also nutrient deprived. Okay, so the next cause of hypoxia are going to be different hemoglobin defects. So the first condition that we're going to talk about here is anemia, which is characterized by decreased amounts of red blood cells. And if we have less red blood cells, that means we're going to have decreased amounts of hemoglobin. And if we have less hemoglobin, that means the oxygen content of the blood is going to be decreased, and so we're not going to be able to deliver as much oxygen to the tissues. The next hemoglobin defect that we're going to talk about is carbon monoxide poisoning. And carbon monoxide binds to the same site on hemoglobin that oxygen does, except for carbon monoxide binds with a much higher affinity. So hemoglobin actually preferentially binds carbon monoxide instead of oxygen. And so as a result of carbon monoxide binding hemoglobin instead of oxygen, we're going to see a lot less oxygen bound to hemoglobin. So we're going to have decreased oxyhemoglobin. And when carbon monoxide binds to hemoglobin, we call that carboxyhemoglobin. Don't get this confused. When carbon dioxide binds to hemoglobin, can you remember what we called hemoglobin when carbon dioxide was bound to it? That's right, it was carbaminohemoglobin. So the next condition that we're going to talk about is something called methemoglobinemia. And remember that hemoglobin has 4 subunits as shown, and within each subunit is a heme molecule, and at the center of the heme molecule is an iron atom in the 2+ state. And it's when iron is in this 2+ state that it's able to bind to oxygen. However, what's happening in methemoglobinemia is all of these irons are being oxidized to the 3+ state, and when iron is in the 3+ state, it cannot bind to oxygen. And that's what we have down here. Iron is being oxidized from the 2+ state to the 3+ state, and when iron is in the 3+ state, the hemoglobin cannot bind to oxygen. And so quickly, I just wanted to talk about a machine called a pulse oximeter. A pulse oximeter is a medical device. It's a small clamp that attaches to your thumb, and it's able to read your heart rate and your hemoglobin saturation. However, one of the classic flaws of a pulse oximeter is that it's not able to distinguish between carboxyhemoglobin, methemoglobin, and normal hemoglobin. And so because carboxyhemoglobin and methemoglobin are poorly detected by the pulse oximeter, when someone presents, they might have severe hypoxia due to carbon monoxide poisoning or methemoglobinemia, and the pulse oximeter is going to falsely say that their hemoglobin saturation with oxygen is completely normal when actually it isn't. Okay, so the next cause of hypoxia that we're going to talk about is cyanide poisoning. So what cyanide does is cyanide poisons the mitochondria in body cells. Specifically, it's an irreversible poison to the electron transport chain within mitochondria. So in the case of cyanide poisoning, the partial pressure of oxygen in the blood is going to be normal, the amount of oxygen bound to hemoglobin in the blood is going to be normal, and the blood flow to the tissues are going to be normal. So the defect in cyanide poisoning actually doesn't involve the blood. The defect is actually at the level of the body cells. When oxygen is already within the body cell, it can't be used by that poisoned mitochondria for aerobic respiration. And so the main defect in cyanide poisoning is that there is an electron transport chain defect. And cyanide poisoning is very severe because it's an irreversible poison to the electron transport chain. And one of the treatments for cyanide poisoning is something called nitrites, which is actually an anti-anginal medication. And what nitrites do is it actually induces methemoglobinemia. It induces the oxidization of that iron in the 2+ state to the 3+ state. And the reason that we induce methemoglobinemia is because methemoglobin can actually bind cyanide and bind it before it travels to the body cells and causes irreversible damage to the mitochondria. And so from there, we can get rid of cyanide from the blood, and then we can reverse the methemoglobinemia by reducing the iron from the 3+ state to the 2+ state. And so methemoglobinemia is the lesser of two evils since it's reversible, whereas cyanide poisoning is irreversible. All right, so now we're going to go a bit in the opposite direction of hypoxia and talk about a condition called polycythemia. Polycythemia is characterized by increased red blood cell counts. This could be due to things like malignancy in the bone marrow, where we're overproducing red blood cells, or this could be a natural adaptation to hypoxia. But either way, we're going to have increased red blood cell counts, and that's going to translate to increased amounts of hemoglobin. And if we have increased amounts of hemoglobin, that means the blood is going to be carrying more oxygen, and we're going to have an increased oxygen content. So now we're going to put some of these conditions together on the oxygen content graph as shown here. On the x-axis, we're going to have the partial pressure of oxygen in the arterial system, and this is usually 100 millimeters of mercury. And on the y-axis, we're going to have the oxygen content, which is normally about 20 milliliters of oxygen per 100 milliliters of blood in the arterial system. And so this is what our normal curve is going to look like here, and this is assuming that there's the normal amount of grams of hemoglobin per 100 milliliters of blood, which is going to be 15. And we can see that this curve looks very similar to the saturation curve, and that's because oxygen content and saturation normally go very hand in hand. As we saturate more hemoglobin in the blood, we're usually going to be increasing the amount of oxygen content in the blood. Where this curve differs from the hemoglobin saturation curve is when we talk about things like anemia or polycythemia, because in these conditions, the amount of hemoglobin that's present in the blood is either going to be decreased or increased compared to normal. And so for these conditions like anemia and polycythemia, their hemoglobin saturation curve would look completely normal because functionally their hemoglobin is normal. However, in the case of something like anemia, we just have a lot less hemoglobin. So even though that hemoglobin is saturating normally, we're saturating a lot less hemoglobin with oxygen, and as a result, our oxygen content is going to be decreased compared to normal. And likewise, in polycythemia, there's nothing wrong with their hemoglobin, it's just that they have a lot more hemoglobin than normal, and so their blood is going to be able to carry a lot more oxygen, and so their oxygen content is going to be increased compared to normal. Okay, so we're going to add one more curve onto this graph, and this is where it gets a little tricky. We're going to be adding the carbon monoxide curve. Okay, so we just have two hemoglobin proteins here, and the hemoglobin protein on the left is going to be hemoglobin in the presence of carbon monoxide. So recall that each subunit of hemoglobin has a certain affinity for oxygen, and the cooperativity phenomena was essentially saying if one subunit of hemoglobin binds to an oxygen, then the result is that the remaining subunits are going to increase their affinity to bind a subsequent oxygen molecule. And not only can oxygen achieve this effect, but when carbon monoxide binds to a subunit, the exact same effect is going to occur. So the remaining unbound subunits are going to increase their affinity to bind a subsequent oxygen molecule as well. And this has some implications for the saturation curve and the content curve. So at very low partial pressures of oxygen, the hemoglobin might only have one subunit that is bound to an oxygen. However, in the presence of carbon monoxide, maybe at very low partial pressures of oxygen, the hemoglobin is actually already bound to 2 carbon monoxides. And so as a result, at low partial pressures of oxygen, hemoglobin might also be bound to 2 oxygen molecules because that carbon monoxide is increasing the affinity of the remaining subunits to bind to an oxygen, even at low partial pressures of oxygen. And so as a result, under normal conditions, our hemoglobin might look like this at low partial pressures of oxygen, whereas in the presence of carbon monoxide, the hemoglobin might look like this at low partial pressures of oxygen. And so we can see at low partial pressures of oxygen, in the presence of carbon monoxide, the hemoglobin is much more saturated, and so carbon monoxide is a cause of the saturation curve shifting to the left. And we can also see at low partial pressures of oxygen, the hemoglobin is carrying more oxygen. So furthermore, the content curve is going to be shifted to the left as well. And lastly, once we get to high partial pressures of oxygen, under normal conditions, the hemoglobin is going to be able to carry 4 oxygen molecules. Whereas in the presence of carbon monoxide, some of the oxygen binding sites are going to be occupied by carbon monoxide, so at high partial pressures of oxygen, the hemoglobin is going to be carrying less oxygen than normal because it's carrying some carbon monoxide instead. And so as a result, the oxygen content of the blood is going to be decreased and our curve is going to be shifted downwards. Okay, so let's just add in our carbon monoxide curve here. We can see that not only is it shifted to the left, but it's also shifted downwards. Okay, so let's just summarize a few points that we talked about in the video. So the first thing to notice is that the partial pressure of oxygen is going to be normal in all of these conditions. The partial pressure of oxygen is unaffected by hemoglobin abnormalities. It's only going to be affected by things like we talked about in the causes of hypoxemia over here. So for anemia, we said we're going to have decreased levels of hemoglobin. However, that hemoglobin is going to be completely normal, and so it's going to saturate normally. And because we have decreased amounts of hemoglobin, we're going to be carrying less hemoglobin in the blood, and as a result, the oxygen content is going to be decreased. For carbon monoxide poisoning, the levels of hemoglobin are going to be normal. However, they're going to be bound by carbon monoxide instead of oxygen, and so the saturation of hemoglobin with oxygen is going to be decreased. And because hemoglobin is carrying less oxygen than normal, the oxygen content is going to be decreased. And the same applies for methemoglobinemia. The level of hemoglobin in methemoglobinemia is going to be normal. However, the iron is in the 3+ state instead of the 2+ state, and so it cannot bind to oxygen, and so the hemoglobin is going to be less saturated with oxygen. And because hemoglobin is carrying less oxygen, there's going to be decreased oxygen content in the blood. For cyanide poisoning, remember that the defect was in the electron transport chain at the level of the body cells, and so it's going to pretty much leave the rest of the blood completely unaffected. And so the level of hemoglobin is going to be normal, the saturation of hemoglobin is going to be normal, the partial pressure of oxygen is going to be normal, and the oxygen content is going to be normal. It's just that those cells are going to have trouble using the oxygen because their mitochondria are poisoned. For polycythemia, we're going to have increased hemoglobin levels, but that hemoglobin is going to be normal, and so as a result, it's going to saturate normally. However, because we have more hemoglobin, we're going to be carrying more oxygen, and as a result, the oxygen content is going to be increased. All right, and that's all we got for our video on abnormal oxygen levels.